Hello, viewers. Good afternoon to you and greetings from Raj Hospital. I'm Dr. Anil Bhoraskar, diabetologist and physician at SL Raj Hospital, practicing since last 44 years. Today is a World Diabetes Day. What is the idea of having a day specially assigned to diabetes? What was the idea for getting this day named as a World Diabetes Day? This is to increase the awareness in population about this disease. Not that people did not know much about it, but as the number of cases are increasing in geometric progression, and now we are almost the world capital city of diabetes, almost treating 5 crore diabetics in India, and behind every known diabetic, there is one unknown diabetic. And this leads to a lot of complications. This is known as a king of disease which produces complication. So if you are diabetes, you're definitely going to have a coronary artery disease sooner or later. And if you survive coronary artery disease with angioplasty or bypass, then cancer is waiting for you. Now, comorbid conditions such as hypertension, obesity, diabetic foot, peripheral vascular disease, retinopathy are such devastating disease that the treatment is beyond the means of a common man. I'll give one example. With a diabetic patient develop nephropathy and the expenditure, and he's on dialysis. So the expenditure per month is almost 25,000 rupees, while prevention of renal disease and the regular checkups for that is just 150 rupees per month. So you'll always realize the prevention of diabetes complications are a lot more easier to manage and more rewarding results than to treat the complications. So, what are the modern methods of treating diabetes? Formerly, when we were students, we had only two drugs, metformin and sulfonylurea, and conventional insulins. And we had to manage our diabetics with that armamentarium. And luckily, we did not have many complications as we were medical students or postgraduate students. The complication rate has increased in last 10 years without having anything to offer to the patient. If the patient comes to me and tells me, Doctor, I have got neuropathy, I got retinopathy, I got a vasculopathy, what do you have to offer me? So I tell them the only thing I can offer you is sympathy. You come a bit too late. If you had come in the early stages with the warning signals were giving you, like look, tingling and numbness in the feet becoming cold in the evening, mild giddiness, vertigo, mild sleep disturbances, excessive snoring or sleep apnea, if you detect them in their early stages, they are completely treatable and they don't lead to complications. Only problem, people tend to neglect these early symptoms and early warning signs. And that is what I'm going to emphasize today. That what does diabetes, after detection of diabetes, particularly type 2 diabetes? You see, the type 2 diabetes today, you see at the age of 30. Formerly, this disease was seen at the age of 45, 50, middle age. But now you see type 2 diabetes of young. And very strange that the detection does not take with any symptoms because the symptoms are very mild and often neglected. And the patients are diagnosed at the time of employment or investigation for insurance policy. They come to know. And there is one test which tells you that you have been a diabetic for more than 3 months. It's known as HbA1c. Your fasting sugar may be normal, your post lunch may be normal, but HbA1c more than 6 is a matter of concern. Now, what is the normal attitude of a person in a day to day, we call it dhakadhaki in Bombay city, that the person has to leave his house at 6 a.m. from Amarnath and has to go to Churchgate. 4 to 5 hours in a day he spends in traveling. At that time, if the diagnosis is made that you have got a mild diabetes, he says, okay, I will stop potato, I'll not take rice, I'll do a little bit of exercise, and I'll control it. And that is what people start making mistakes because they take it very casually. Early onset of diabetes has to be treated like a war. So, what are the things that we see in the first few months of a detection of diabetes? Thorough clinical examination. We just, unfortunately, what has happened, very busy doctors, they just look at the reports. The age old method of clinical examination is not followed very strictly by many family doctors because they have no time. They see about 50 or 60 patients in one session. So, what is the first thing is a detailed history. And history is giving you clue. If you get up in the night to pass urine, you say, yes, but somebody has told me that you should drink at least 2 liters of water before going to bed. I said, that's the wrong practice. If you don't drink too much of water at night, you still have to get up in the night to pass urine. I say 1 or 2 times or 5 times sometimes. Okay, that is one. How are your trousers? Are they fitting you all right? Oh no, what has happened because of this work and all that and too many cocktails and this. My waistline somehow is increasing. I said, that is the first danger sign. Your lifeline is inversely proportionate to your waistline. Remember that. The biggest risk factor in type 2 diabetes is the waist circumference. And unfortunately, we are called as thin fat Indians. Genetically, although our BMI is less than 21, our waist circumference is more than 90 centimeters. And all the fat that is in the abdomen, visceral fat, which is a dead weight, which is a white fat, which does not have mitochondria like a fetal fat, which is brown fat, is a white fat is a biggest enemy of a man. It leads to not only coronary artery disease, not only cancer, but also called what is known as fatty liver. And quite a few diabetics at the outset, when you do their examination, they have 1 or 2 finger palpable liver. So you understand, a diabetes has got about 12 reasons. We call it 12 enemies, dirty dozen. They are the ones which are producing hyperglycemia. And therefore, these 12 areas can be intervened today by various drugs. That is a modern treatment. Each area which you affected, most important is a insulin resistance syndrome. Genetically, we are all insulin resistant people. What does that mean? That means you are producing adequate amount of insulin. Insulin is not less, but where it acts, where it's supposed to act, like fat cells, liver, muscle, there is a receptor blocking. The receptor to receive the insulin to go inside the cell is blocked, and that is called insulin resistance, and that is at the cellular level. Now, what are the drugs which act on the insulin resistance? Age old metformin, and there are many new drugs which are available which act on the receptors. They increase the receptor sensitivity and allow your own insulin to act. So, although there is no insulin secretion in excess, the same insulin is utilized properly at the cellular level. And that is a very important thing. You have to train your body to utilize your own insulin, which is sometimes produced in adequate amount or sometimes excess. There is hyperinsulinemia, and hyperinsulinemia is not without any price. If the insulin producing adequate and is acting well, it's good. But if insulin produces excess, it causes salt and water retention, it leads to hypertension, it leads to atherosclerosis of the arteries, it leads to so many other dysfunctions. Excess insulin or hyperinsulinemia can also produce multiple problems that you see in a diabetic patient. So you have to use your own insulin in a smart way. Now, what is the best way to use your own insulin? The only way to use your own insulin effectively is vigorous physical exercise. I always tell patients, if you don't do exercise for about 45 minutes in a day, you have no right to eat. You have no right to eat food if you don't exercise. So first thing in the morning is 45 minutes of walk. Now obviously people say, sir, we have got no parks and we have got roads which are blocked. So where do I walk? I say you walk in your own house. As a house is small, I say you can go to your terrace. And which floor you stay? Say I say stay on the seventh floor. Then don't use an elevator. All 7 stories you try to climb up as well as climb down. Initially, when you start this program, first climb down. Then as you develop a good amount of stamina and good amount of agility, you take a program, 1 floor, 1 week, second floor, second week, third, like that. Over a period of 1.5 months, you can climb 6 floors without increasing your pulse rate. Now that's a very important. Supposing after climbing 6 floors, if your pulse rate goes about 72, which is normal 65 to 70, if it goes to 100, it is not a good conditioning of the heart. At the most, it can increase by 10%, but within 5 to 10 minutes, it must come down to basal rate. That is a good conditioning of the heart. If your heart is not compliant to exercise, then you need to see a cardiologist. And he'll do a stress test and find out how much exercise you can take. Never attempt to take a strenuous exercise at the age of 40 without knowing how much your heart can take exercise and accordingly gradually increase step by step. Some people say, I done 10,000 steps. I say 10,000 steps over a day, full day. Count the stepper, number of steps you have done the whole day. So if you do that gradually, it is not a taxation on the heart or joints, knee joints particularly. Second thing I must also tell you that sometimes household work also helps you reducing weight. How did you find out this? During the COVID time when the maid servants were not there, all the ladies in the house, they lost as much as 10 to 15 kilos of weight because they had to do sweeping, swapping, washing, all the household activities, cleaning, and the greatest activity that you'll be surprised to know, if you iron for 30 minutes, it is like walking for 30 minutes. If you do ironing yourself, iron your own clothes, make that a habit. These are all small, small activities will give adequate exercise to keep you supple, active, and functional without having any strain on your joints, skin, feet, particularly feet are vulnerable in diabetics. The pressure points have to be studied first, whether and always wear a nice shoe wear which is comfortable, one size bigger, and should not hurt any toes or anything. Make sure that you walk first with the shoe at home, then you start going for walks on the ground. Always walk on a ground which is not concrete, which is either a soft grass or soft sand. Because walking on a hard surface will push all the stimuli, all the jokes, jerks, everything back to the joint. That is what you have to avoid. I'm not saying you must put carpets in the house, but you can wear a good, nice, comfortable shoe wear which you can wear at home. Always have a separate pair of shoe to use it in the house and one separate pair to use it outside the house. Now, these are all small tips. They look very simple, but they have a long term beneficial repercussions, and you can prevent coming to a hospital or a food clinic after developing a food problem. This is one mantra which I always tell people, that you must have an habit to examine your feet every time you get up in the morning. There is a Sanskrit saying that Prabhate Karadarshanam. I say Prabhate Pagadarshanam. And even night, when you take out your socks and go to sleep, inspect your feet in detail. Maybe use a magnifying glass and a torch. And you may find it funny when I tell you that many people, because their protuberant abdomen, are unable to see their inner aspect of the feet. Then you can take your spouse's support at night. And after the age of 45, it is a good practice to check each other's feet before going to bed. Look at any sore areas, look at any redness, look at any kissing ulcers between the two toes. Sometimes the ulcers are formed, but they are not perceived because of poor sensation. Diabetics have a peripheral neuropathy, they have a low sensations. They don't recall any injury, they don't recall any stress. They can develop a stress fracture of the phalanges, and they may have what is known as an ingrowing toenail, which can cause small inflammation and can develop an abscess. And very, very rarely it can produce a foul smelling odor. Foul smelling odor of the socks after wearing a pair of socks which is fully washed in the morning. Always wear socks which are cotton socks, which are washed, and after washing, see that the creases are made straight and they are comfortable while wearing. The elastic should not be very tight. It should not squeeze the area above ankle. After wearing socks, you feel comfortable. Change the socks. If you're walking quite a lot in the day and wearing shoes for more than 8 to 10 hours, then you must change the socks twice a day. Once in the morning, once in the evening. You may wear a pair of socks at night because a lot of people find it comfortable to wear a loose fitting socks at night because breeze of air conditioner and all can give you some amount of discomfort. If the socks are worn and the blankets are kept above that, a lot of people come up. Make sure that the socks are washed at morning and night. So these are all few mantras which are really beneficial. Second thing, care of the skin. Where is the person wearing tie whole day? You may get some amount of abrasions in the groin, in the joints area. The trousers may be tight fitting, and the whole day you wear a trouser. At the end of the day, when you try to clean yourself, you'll see that there are some sore areas. Apply mild antibiotic creams, soothing creams, skin protective creams. There are multiple creams available. Don't use any stringent or aggressively hurting ointments, antibiotic ointment particularly, what they call more irritation. Use a softener, skin softener. And when you wash your clothes at home, make sure the soap is of a highest quality and the conditioner is added, or fabric softener is also added. So you wear soft clothes, particularly at night, which will not cause you any hurt. So these are all small, small things which are maybe you may feel it's a trivial that I'm giving you this image, but yes, this is a very important method of treating the simple problems becoming bad. Care of the nails, very important. Cut the nails not too close, but use a file, particularly feet. Don't cut with a nail cutter too deep. Keep it in line, absolutely like this. And then use a file to gently smoothen them and apply little cream on the tip of that. Manicure and pedicure can cost a bomb if you go to a beauty parlor. But all those things you can do it at home yourself. Then, care of your teeth. Brush your teeth two times, once in the morning and once in the night. In fact, brushing at night is more important because all the food particles would get lodged and can invite germs. And make sure the health of the gums is good because it can lead to gingivitis, pyorrhea, and if the teeth are not attended, they can cause abscesses, and you may have to go to a dentist, and they will do what in the root canal and all that. That all the procedures need that the diabetes is extremely well controlled. Any surgery on head, face, neck, particularly cataract, eye surgery, face, sugar must be absolutely normal. Little high sugar we don't allow. Even root abscess, tooth extraction, all have to be given the equal respect as you give to a major surgery. No surgery is taken lightly in a diabetic patient. Now, there is something which is very important. A lot of diabetics are also simultaneously put on aspirin, copicrel, Novak is that the new drugs, anticoagulants such as dabigatran, apixaban, and some of the people with the valvular heart disease, they are on acetylene. Now, all these drugs make you vulnerable to early bruising and bleeding. So this has to be brought to notice to your doctor. Ki, look here, I get some spots, and you may have to do what is known as thrombocyte count, platelet count regularly, and find out the areas where you are vulnerable to bleed. So that is because many of the diabetic patients are also on simultaneously antihypertensive agents. They are also simultaneously on blood thinning agents. They are on antioxidants. So diabetic can have a prescription ranging from 8 tablets to 20 tablets in a day. That becomes a big burden. Omission of medication because of want of freedom from medicines, and obviously cost. And most important, the worst is the duplication. A lot of people, they don't remember whether they have taken a dose of insulin in the morning or not. My dictum is I tell my patients, if you have forgotten to take your medication, do not take it. Rather than omit it one day, and next day after you take the medication, make a tick mark that I have taken. But taking a dose duplicate can be a disaster. It can suddenly reduce your blood sugar known as hypoglycemia. And what happens, many patients, they take this extra dose of insulin and they eat the same amount of food that they eat. At 4 o'clock when they are on a scooter driving, they develop hypoglycemia and can meet with an accident. This has happened in many of my patients' cases. Now, remember one thing, people who take insulin and also multiple drug therapy, like 3 drugs, 4 drugs, 5 drugs. Some of my patients who come to see me, I don't know, there is a lot of reluctance on the part of doctors to start insulin early. If the blood sugar is more than 140 on 3 occasions, fasting 150 and more, 140 and more, post lunch 200 and more on 3 occasions, in spite of multiple drug therapy, this is an indication to start the patient on insulin. HbA1c more than 8 on 3 occasions is an indication to start insulin. You can step down the dose of oral hypoglycemia and add on insulin. Insulins are multiple: short acting, ultra short acting, long acting, intermediate acting, and there is a big science of insulin therapy that you have to trust your doctor who's treating you, caregiver, and take his advice in terms of dosage, monitoring, and seeing the effect. Now there are multiple gadgets available for monitoring. CGMS, continuous glucose monitoring, is a small sticker. You keep it on a, it's a kind of a sensor which gets stuck to your bicep. You can have a reader. It tells you this is your sugar. So it tells you a lot of information, and a lot of information of a particular individual, because today we give what is known as individualized therapy. One size does not fit all. Remember that every individual is different, and you have to consider many aspects of this man's job, eating habits, time profile, action profile of the drugs, and this is very important when you individualize the therapy for diabetes control. CGMS is a very important tool. Also, check blood sugar with a glucometer when you're changing on CGMS. CGMS sensor, and this sometimes can show a difference of 20 milligrams. This is 20 milligrams more, this is 20 milligrams less, because this is showing you interstitial blood sugar. The RBCs, when they come from the periphery to the arterial venous junction, capillaries, they shed as much as 20 milligrams of glucose. So if this is 180, this should be 200. Anything more than that, there's something wrong with the sensor. 20 milligrams is acceptable. Anything lesser than that or more than that, you have to change the sensor. And the company replaces it. But it is a very important tool. It tells you many things. It also tells you what are your activity profile, ability to reduce your blood sugar. Now, a lot of people say when I walk fast for 40 minutes, I think my blood sugar comes down by 100, 150 milligram. And that is true, because when you go for a morning walk, you walk with the spirit, and particularly when you walk in a park and you're walking and there are some young people walk next to you and they walk faster, obviously. So you tend to compete with them. If somebody overtakes you, you don't like it. But remember one thing, he is doing it at the age of 30 and you're 60. So keep that in mind. But it also tells you, if you are on a sensor, that if you walk at that speed, how much blood sugar is dropped in half an hour. So you get your complete body's parameters recorded. It is important to record the blood sugar before walking and after walking, so you know how much exercise you can take. Now there are telltale things that if you eat karela, if you take methi, your sugars don't go up. Verify that, because karela preparations can vary from family to family. Sometimes karela bhaji is made in deep fried oil and it is made kurkurit, or sometimes karela made a stuffed karela. The karela is open, then they put a lot of masala in it, like fried onion, potato, and some of them to reduce the bitterness, add even sugar. Then roast that whole karela in a small thread and deep fry it. Karela's entire caloric value goes up high, and you have two or three thinking that karela is good for diabetes, and your blood sugar goes to 200. So this is what you have to experiment on yourself and take a logbook. What causes rise of sugar? What causes drop of sugar? What can suit me? Remember, one man's food is other man's poison. Not all food is healthy or unhealthy for same individual or otherwise. So study your own body. It's a good exercise to keep a logbook. Having done that, certain amount of self-discipline is very important. I've given a lecture on the role of Bhagavad Gita in managing diabetes. In 15th Adhyay, Shri Krishna ji has told that all chronic disease management is in your own hand. My great guru used to say, Dr. Raja, the treatment of diabetes, heart disease, and cancer is not in the hospitals or in the clinics. It is in your own kitchen. Bhagavad Gita, Sri Krishna ji also has said same thing, that there are certain personalities, sattvic, tamasic, and rajasic, and their diet pattern also varies from person to person. I tell my patients, look here, a man is what he eats. If you eat a sattvic ahar, your thought process is also sattvic. You don't think that this should be achieved in a short time, make unlawful money, do criminal activities. This is all depend on your diet. Now, if your diet is sattvic, on time, regularity in meals, timing, and a disciplined diet, these people, they look different. The chehra is sattvic, glowing. While tamasi chehra, you can see restless, sweating profusely, irritable. It's all diet. Gastric upset, belching, murmur, inattention to work. This is all related to wrong diet. Wrong diet is tasty. Street food, vada pav, bhajia, pakoda, usal. Who doesn't like it? But little and not every day. Keep that mantra that every day you should eat a sattvic ahar. Once in a while, on festival, you can have little peda, little only one. Or on Ganesh Chaturthi, there is Ukditam Modak. There is a health benefit of Ukditam Modak. I have given a lecture on that. But when you eat only one, if you eat five, it does not serve the purpose. So, moderation in eating, moderation in talking. Do not, my mom used to tell me, Anil, तोंडात ना काही काढायच्या अगोदर आणि तोंडात काही घालायच्या अगोदर 10 मिनिटं विचार कर. Whatever you take out from your mouth and whatever you put in your mouth, think 10 times. I wish today people would really think 10 times before they utter nonsense. And all the political mess that you see, somebody said this, and we'll see him in the this. That is all continuous verbal fights. If only people talk less and work more, many problems can be solved. I personally feel that we need a lot of training in that direction. कमी बोला. मनात आलेला विचार लगेच बोलायचा नाही. You think over it की बाबा what repercussion it will have when I say something like this. Think about it. God has given you ability to think. Anything that you say, you should not have to regret and say sorry. You should say things which matter and people respect that. So this is a general funda of how to manage diabetes. A well-arranged diabetic plan, a person whose diabetes profile is excellent, his life is excellent. His children are well behaved. There is a discipline in the house, and there is a peace of mind. People who are not at peace with themselves and make mistakes in eating and drinking, and a lot of people have seen, particularly, there are a lot of festivals in our country. After 365 days, there are 265 festivals. And festivals means compulsorily you have to eat rich food. You should see the amount of food which is served in these days marriages, so-called buffets. They talk about food pyramid. At the top of the food, there is a small sweet dish, then basil, then carbohydrates, then vitamins. This is a ideal food pyramid. What you see in the marriages, good looking but bulky females and males. They are carrying the dish, taking food from all the counters and making a pyramid of food in their plate, loaded with rice, then rajma, then dal, then little salad and achar on the top. This food pyramid, almost 1200 to 1500 calories and 30% saturated fats. This is kind of food is served in marriages. An amount of food that we waste because we normally help ourselves with the food almost 2 to 3 times than what we can eat. We can't finish all the food. Good for that. But if that food is thrown and one third of the country is starving, why waste food? So why take so much food in your plate? Have a taste little. The host is not going to feel bad. But the point is, this is a culture. And this culture is now changing because there is a lot of modernization. Do you know there are at least 30% of office going couples do not prepare dinner at home? I know certain communities, I am a doctor of many communities. So some of the communities at night, there is no food prepared at home. Many people eat food in Rama or Udupi restaurant, Mysore Cafe. At Matunga, in the evening, you will see cars parked, and on the top of the car, the entire family is standing and ordering food from various cafes, which are very famous, very tasty food. But that food is consumed by all the youngsters as well as the adults, and there is no food prepared at home. Ideal food when you're tired whole day is there is nothing like khichdi, dal khichdi, chas, and salad. Now you tell this to your patients, ऐसे काय का डॉक्टर इतना पैसा लिया मेरे से कि खाने को क्या दिया ऐसा दिया. So people want to eat good food all the time because as a reward also in the childhood, if you study first, the mother says that I'll give you chocolate. Our rewards are in form of sweet dishes. So this is what the cultural influence on diabetes, and today that's the price we are paying. A society in 40 years which was at the lowest level of incidence of coronary artery disease, heart disease, and diabetes, it has become a society with the highest number of cases of heart disease and diabetes over a period of 30 years because of street food, because of junk food, because of packages food and given to children. You see, problem the children have stopped eating bhaju puri or puri laddu because both the parents are working. The child has to go to school. Mother has no time to prepare a dabba, or even if she prepares a dabba because peer pressure, the child does not eat that dabba. He feels shy because the rest of the boys have brought cash and they buy canteen food. So the childhood obesity is a very big problem in India now. So this has to change, and that is my own mission that I will change the habits of people to let them live a more comfortable life and have a disease free adulthood as well as early aging process. Early aging is a big problem. People want to live longer. Only thing, when you want to live longer, you have to sacrifice certain things. They are not willing to do that. They join gymnasium, and outside gymnasium, there are restaurants which serve all fried food. Clubs, I go for swimming. Just outside the swimming pool, there is a cafeteria. And who is patronizing this cafeteria food on the tables laid down around the swimming pool? Young children whose mothers have come for competitive sports after swimming, they are voraciously hungry and they order masala dosa, sandwich, grilled sandwich, cheese sandwich. They have no time to wait because by then they are so hungry. They will eat all that stuff, and the night, what they will do? I'm not hungry. They will not eat anything, and they may have a custard, or they may have some sweet dish and go to sleep. Completely wrong timetable. According to me, in the clubs or in the areas where swimming pool, there should not be any food stuff available unless you are a diabetic and on a special diet. You should carry a sandwich or you carry some healthy food. But keeping a cafeteria next to swimming pool is asking for trouble for particularly the young children. I always resented it and criticized wherever I go, and many of the clubs have probably decided to take out my membership because this man, because the real money making areas is a restaurant. There are lesser number of people swimming than more number of people eating. So this culture has to change. And to fight this culture and keep on digging, you must, doctors should appreciate that they will become slightly unpopular. People may not like them, people may not come to them, doesn't matter. But you have to give a solid, sound, scientifically, absolutely 100% truthful advice. And this is what I insist many times. And many of my patients have blessed me also. Many of patients have brought their children, grandchildren. I have got a four generation diabetes practice. Many people have criticized me, many people have blessed me, but I like to propagate this philosophy of eating through this kind of programs on various days, and this should be a matter of habit and not a good exercise pattern and a good exercise eating habit should not be a matter of accident. It should be a matter of routine in your life. So, friends, I have talked enough. I am very happy that I got an opportunity to disseminate some form of truth about diabetes to all of you. Thank you very much. Jai Hind.